All right. Perfect. Okay, so the first slide, I've got a few PowerPoints going on. So can I get a thumbs up that the slide you're seeing is today's event with some time? Like, great. So just to go for an overview of what to expect today, I'm going to kind of give a background of who 4 in 10 is and what we're about. Then I'm going to hand it over to our first speaker, Dr. Elizabeth Fisher from Nuffield Trust. And then later we're going to hear from Isabel Rice, a registered dietitian from Sustain. And then we're going to leave a few minutes at the end for questions. So who is 4 in 10? For those of you who don't know, we are London's Child Poverty Network. So we are a network of organizations focused on responding to, mitigating, and ultimately trying to end child poverty in London. We have over 600 recipients of our newsletter and over 500 members that are organizations. If you're not currently a member, and you are working in some area of child poverty in London, we'd highly encourage you to join. It's free. And the idea is to help build collaboration and campaigning together on issues that we all care about. So what we provide to our members is a range of free events like the one you're attending today. Some of them are focused on information and policy, others around capacity building. And then we also plan coffee mornings, which are a smaller event online. And it's really an opportunity for organizations often responding to really intense need, being able to share and unload and complain about the frustrations that they experience. And it's a time to really support one another and let off some steam. We also conduct research, which is another part of my role, and we're now beginning a project around childcare and accessing childcare across London when you're faced with financial barriers. And so if you'd like to learn more about that particular project, please do get in touch or pop a comment in the chat and I can follow up with you on that. Sustain is one of our members who is part of a smaller subgroup of our network, which is the London Child Poverty Alliance. This is a group that's really focused on developing and campaigning around policy issues that are kind of the drivers of poverty or policies that have the potential to end child poverty in London. And so we focus on different levels of government. So it might be local, regional, and national, and highlighting that change that we need from a government level to make child poverty a thing of the past. How we keep in contact with you. If you're not currently receiving our newsletter or following us on social media, please do. It's the best way to keep in touch. If you're looking to engage with other organizations, our Give and Get Help support directory is a great resource for that, and you'll be able to narrow down by location or topic, and that is on our website. Just a quick plug, we host London Challenge Poverty Week every year in October, and I wanted to share the link to the website for London Challenge Poverty Week, which is a series of actions that can be events, campaigns, meetings, report sharing around poverty as it exists in London across all ages and all social groups. And so this is an opportunity to really come together and to highlight your own work, but also collaborate with other organizations. So if you'd like to get involved, please do get in touch. You can book a one-to-one meeting with me to kind of talk through some different ways that you can get involved, either by organizing your own activity, or in fact, we can highlight or signpost you to other organizations that are planning things and you can work together with them. So why are we here today? I'm just going to kind of set the scene a little bit before handing it over to the experts. Unfortunately, the evidence is clear that child poverty and health inequality have a relationship. So as evidenced by the Marmot Review, both 2010 and 2020, poverty causes ill health and drives health inequalities between the rich and poor. This is true across the country, but looking at London, really does provide some stark examples of health inequality, which will be discussed today. The Institute of Health Equity shows that in their cost of living report focused on London, that life expectancy decline in London's more deprived areas exists, and this highlights the impact of poverty. So some examples of how health inequalities can manifest, these can include poor mental health, poverty in childhood causing long-term illness or developmental delays, inadequate support for disability, nutritional deficiencies, more time in your lifespan spent in poor health, and shorter life expectancy. So some key points. The GLA conducted some polling that was quoted in the Rising Cost of Living, a review of interventions to reduce impacts on health inequalities in London that was put out by the Institute of Health Equity. And they found that 65% of local residents who are struggling financially were claiming that they were buying less food and going without essentials. And food insecurity is driven by insecure and insufficient income. And food banks, while an important response, have been shown in growing consensus amongst researchers that while they absolutely respond to need, they don't help reduce demand. And so they're not a long-term solution. So why talking about children's diets matter, which is what we're going to talk about today. I just wanted to highlight 3 case examples to spark some thinking. So one would be children with dietary restrictions due to health conditions like celiac disease or cultural restrictions. So this can mean that food that's suitable is limited and therefore higher costs can be felt more acutely. A second are children with sensory needs. So they may have particular preferences that lead to limited options and lack of flexibility. And then another one that we're going to touch on is proximity and choice. So that can lead to children having cheaper fast food be the accessible option that may mean they're not getting all of their nutritional needs met. I wanted to end just by pulling out a couple of slides from the Broken Plate report for 2023, just to highlight some key statistics that I thought were quite summed up this problem quite well. So under the price and affordability column, you can see affordability of a healthy diet. And it says that the most deprived fifth of the population would need to spend 50% of their disposable income on food to meet the cost of the government recommended healthy diet. And this compares to just 11% for the least deprived fifth. And then moving over to the next column, places to buy food on the high street. 1 in 4 places to buy food are fast food outlets. So what needs to happen in this recommendation is local authority planning powers to prevent further proliferation of unhealthy fast food outlets. And then just one more slide. If you look on the health outcomes, that kind of red box, children's dental decay. So almost a quarter, 24% of 5-year-olds have dental decay, with 2.5 times as many children in the most deprived fifth affected compared with the least deprived fifth. So these are just a few examples. The Broken Plate has many, many more. But now I want to turn it over to our speakers to hear from them directly. So I'm going to stop share to give Dr. Elizabeth Fisher a moment to upload her slides. So just to introduce our first speaker, Liz joined the Nuffield Trust in May 2012 and is the Trust lead for the Children and Young People's Programme. During her time at the Nuffield Trust, she has worked on a variety of projects and topic areas, including international comparisons, public health, service evaluations, projects that employ new ways to use data, and submissions by the Trust to the Health Select Committee and responsive commentary. And she will be speaking to us today about child obesity and asking the question, is where you live important? Over to you.
Thank you, Emily. Can I just get a quick confirmation from you? You can see my slides. Brilliant. Thank you. Okay, thank you for that introduction. I also want to just take a little bit of time to acknowledge my colleague, Eilish Keeble, who also did a lot of the sort of legwork on this in terms of the analysis and also co-authored the report with me. Today's talk I'm going to give you a bit of context in terms of why this kind of research we think was important. I'm going to talk through the approach we took, what came out of it, and why that might have been. And then I'm also going to talk briefly about the COVID-19 pandemic, because we did this analysis before the pandemic hit, and the data was before the pandemic. And then I'm just going to give you a few concluding remarks. Hopefully it shouldn't take more than 20 minutes. Okay. So why did we undertake this work? Well, I'm not going to go into the full details of why it's an important area to be tackling, but we do know that childhood obesity has many short, medium and long-term impacts on the children's physical health, mental health, and other outcomes such as educational entertainment. There's also a large economic cost to the NHS and local authorities and wider society. But despite how important it is, prior to the pandemic, there were worryingly high levels of childhood overweight and obesity. So if you look here on the red line on this graph, this is reception-age children, that's 4 to 5-year-olds, and nearly 1 in 4 were overweight or obese. When you look at the year 6 age children, the green line here on the chart, there were over 1 in 3 were overweight or obese. And actually, even more worryingly as well, there's been no improvements in these levels over time. Another reason why we wanted to take this work is we saw a lot of variation and inequalities across England. And if you look in these boxes here, just to the left of each of the maps, you can see the London-specific boroughs, and for the year 6 in particular, compared to the rest of the country, they're quite stark levels of overweight or obesity in the year 6 children. And all these findings exist despite there being actually numerous initiatives, both nationally and locally, to combat the crisis. But much of the research used to inform the policy on childhood obesity has been based on the ways of changing behaviour at an individual level, which some argue can be seen as actually blaming individuals and families. So we undertook this hypothesis generating piece of research, and what we were trying to do was look at the associations between childhood excess weight, by which we mean overweight, and obesity, and a comprehensive set of local area characteristics. So the aim was to answer the research question: what are the key wider determinants of childhood excess weight and obesity at a local area level? And we thought this was particularly important for children, as they do not actually choose where they live. We hoped it would provide a focus highlighting which local area characteristics might be the most useful to further explore and research and target. We thought it would be timely as integrated care systems develop. And if you haven't heard about this is a fairly new way of working, where partnerships of organisations working within a system come together to plan and deliver joined up healthcare and services with the aim to improve the lives of people who live and work in that particular area. We also hope this work would provide a new methodology that it could be adapted locally, using locally held data to support better local decision making, possibly a smaller area than the local authority footprint, recognising there's actually heterogeneity even within an area the size of a local authority. So what did we do? So we started out by looking at the existing literature and evidence, looking for publications on childhood obesity and the environmental factors such as the nature of children's neighbourhoods and communities. We also identified literature that discussed conceptual models for early childhood development. And from this, we identified some common themes and suggested measures that you can see in this table here on the right. So in the left-hand column, we've got the theme, and then in the right-hand column of the table, we've got the suggested measures. Using this as a guide, we then sourced publicly available numeric data at the local authority level to represent these themes and measures. We were able to find data for all the themes apart from these two highlighted here with the yellow boxes. So that's the home environment and the obesogenic characteristics of the early years childcare environment. We also included an additional socioeconomic and demographic measures. We included these as we know that there were inequalities in childhood obesity relating to deprivation and ethnicity, and we wanted to adjust for those in our analysis. We then used the 2018-19 overweight and obesity levels for reception-age children and year 6 Year 6 children. That's from the National School Measurement Programme. And we ran a series of regression models, which is, if you don't know what those are, they're kind of statistical methods that determines if there's any relationship between the characteristic at the local authority level and the obesity levels at the local authority level. So moving on, what did we find? So there are a whole series of results that we got from several regression models, but I'm going to just focus on what we found in our fully adjusted regression model. So this takes into account all the characteristics that we had at once. So for reception age children here on the left-hand side, we found that there were 5 local area characteristics that were significantly associated with levels of excess weight and obesity. So for example, here in the yellow box, for reception age children, areas that have high levels of children under 5 who are living in households that are in receipt of out of work benefits are more likely to have higher levels of reception age children who are overweight and obese. The difference between the 5th local authorities that have the highest proportion of children in these households and the 5th local authorities that the fifth local authorities that have the lowest is 3.5%. Now, that might not seem like a big difference, but when you think about the number of 4 to 5-year-olds that can be in a local authority, that's quite a large number of reception of children that are more likely to be overweight and obese. For year 6 children here on the right-hand side, we found that there were 7 local area characteristics that were significantly associated with overweight and obesity levels. We possibly see that more associations in this age group because they've been in the environment longer, so there's more time to have an influence. So from these results, we synthesized 4 key findings. Overweight and obesity levels amongst children are likely to be higher in areas where there is poorer access to places for children to engage in physical activities, and actually surprising where fewer adults actually undertake physical exercise as well. There is more childhood poverty. There is a greater proportion of the population who are from minority ethnic backgrounds and areas where there are lower breastfeeding rates. Because of the audience today, I'm just going to focus on the childhood poverty finding. So for both reception age children and year 6 children, we see measures of childhood poverty are associated with levels of overweight and obesity. In where there is greater childhood poverty, we see higher levels of overweight and obesity. For reception age children, as I mentioned earlier, this is for those under 5s that are in receipt of out of work benefits. And for year 6, it is children living in low income families. These different findings might be reflective of how good each of these measures is a proxy for childhood poverty at the different ages. You can also see that the difference between the worst local authorities and the better local authorities in terms of childhood poverty is greater for year 6 age children. So we've got 6.9% here and 3.5% for the reception. And again, this might be related to the length of exposure. Now, one thing I will want to note is this methodology does not identify, well, what it does identify significant relationships between the two measures, but what it doesn't do is provide evidence. So in other words, it doesn't provide evidence of causality. So in other words, it doesn't prove that poverty causes obesity, it just strengthens the evidence that they are linked. However, if there was a causal mechanism, what might be behind that? So this is similar to what Emily was talking to at the start in the research, looking at the literature. The first thing it might be related to is physical activity. So if you remember back earlier in my presentation, one of the other key findings was that obesity levels amongst children are likely to be higher in areas where there is poor access to places for children to engage in physical activities. So, and this included measures around access to green space, which the evidence actually shows follows a socioeconomic gradient. There is also socioeconomic inequalities in taking part in organised sport. So often cited barriers include time and economic costs, which are more likely to influence participation decisions for families on low incomes. The second possible explanation might be diet. The first part of this is it's probably an issue with economic access to healthy foods. So healthy foods are more expensive than unhealthy foods, and actually, worryingly, the difference between the two is widening quite considerably. And similar to what the Broken Plate report that Emily mentioned earlier found, the Food Foundation found in 2021 that the poorest fifth of UK households would have to spend 40% of their disposable income to meet the costs of following the NHS's guide on what to eat and to have a balanced diet, compared to the richest fifth, where they'd only have to spend 7% of their disposable income. There is also possibly easier economic access to unhealthy foods. For example, food promotions such as buy one, get one free are more likely to be used for unhealthy foods and drinks. They're more likely to be persistently used than for healthier foods. And actually, studies have found that these kind of promotions do make you buy more of them than you actually need. The last part in relation to diet is also then poor physical access to healthy food and easy physical access to unhealthy foods. For the poor physical access to healthy foods, there are areas that have been described as food deserts, where there is a lack of sufficient public transport and lack of shopping options to be able to access healthy foods. And there is some evidence these areas may be linked where there are higher levels of population level child poverty. For easy physical access to unhealthy foods, we didn't actually find in this particular research an association between fast food density and child excess weight and obesity when we took into account all the other factors. It was significant when we were looking at just the relationship between the fast food density and levels of overweight and obesity, but not in the fully adjusted models. But I have been involved in a previous piece of research where we looked at in Wales, where we did actually see that relationship between fast food density and childhood obesity. And looking at, I think it's Public Health England's analysis of fast food density. Fast food density is higher in areas where that are more deprived. So with pressures on family finances, such as rent, mortgage, energy and fuel to keep within their budget, some people just don't have the choice but to buy unhealthy foods and not take part in organised sport. And this comes back to what, in order to tackle this crisis, it's not going to be just about changing individual behaviours. So the COVID-19 pandemic. Said our analysis predates that, but I thought I'd spend a few minutes talking about the impact it might have had. So the first bit might be around the an individual's ability to maintain a healthy weight. So studies have indicated that schools regulate the obesogenic behaviours of children, such as participation in sports, their diet, regulating sleeping patterns. So the impact of the school closures on levels of overweight and obesity might be interesting. There was also widespread closures of recreational spaces, such as swimming pools, playgrounds, indoor play spaces. But also the pandemic may have prompted some individuals to take steps to manage their own weight due to obesity and overweight being a risk factor for poorer outcomes of the COVID-19 infection. But one study did indicate that children's physical activity levels in the UK were significantly lower by the time restrictions were lifted. There's also been, during the pandemic, there was a significant reductions in NHS and non-COVID public health activity during the pandemic. Weight management services were unlikely to have been immune to this. So, for example, the child measurement programme that collects this data that we used was stopped for a time, meaning that those that were overweight or obese would not have been identified, and services could not act on that information. The third area I'd like to touch on is the impact on families' finances and food insecurity and the new cost of living crisis. So modelling indicated that immediately after the start of the pandemic, that 200,000 more children would have been in poverty by the end of 2020. The Food Foundation estimated 2.3 million children directly experienced food insecurity in August 2021, and that represents more than 1 in 10 households with children, and it's considerably higher than the same month in 2020. Moving beyond the individual finances, then we have the wider economic impacts of COVID-19 and the current economic issues. So learning from history, when we've seen sort of difficult budgetary constraints, this has led to reductions in non-statutory services. So this includes stuff like the Sure Start centres, which some studies have shown have had a positive impact on children's weight. And it's not limited just purely to children's services. So local authority departments also had reduced funding prior to the pandemic during austerity. And this led to local authorities increasingly more likely to sell their parks, close park facilities, and such as the green gyms and play equipment. And actually, I've seen recent surveys indicating that this might be happening again. The pandemic has also shone a light on inequalities, which align with the health inequalities discussed in a report that we published alongside this research. And if people face in those groups face additional socioeconomic burden because of the pandemic, and they're also excluded from accessing health services due to an increasing digital divide and a digital-first policy in health. This may further impact on childhood obesity, and then also widen inequalities. So the future. So as you can see here on the left-hand side, this bar chart in the far right bar, you can see during the pandemic, the levels of overweight and obesity did actually increase. And this wasn't universally felt. So here for the light blue line at the top, that's the year 6 age children. And it was the most deprived that saw the increase compared to the least deprived, which is the red line. And similarly for the reception, the most deprived is the purple line. And you can see the increase there, which wasn't to the same extent in the least deprived in the darker line at the bottom. So my concluding remarks. So all this kind of research actually highlights the complexity that leads to childhood obesity, and actually how they all interconnect as well. So some of the stuff I haven't shown you around the interconnection of the poverty and ethnicity, ethnicity and access to green spaces, they all sort of interconnect, and how they play out together, more research is needed to understand that better. Also highlights the importance of a child's circumstances and the environment that they grow up in, and it's solely focusing on changing children's and families' individual behaviours is not going to be sufficient to deal with the obesity crisis. It also highlights the importance of some current and proposed policies. So, for example, breastfeeding promotion is a current policy within the NHS. You know, the importance of that is shown through this research. The food promotion strategies that are planned and health impact assessments in local planning. But this does come with a word of warning. So if you looked at the proposed policies in relation to, which is now delayed, around the food promotion ban, it's actually only, if you look into the detail, it's actually for only certain shops of a certain size. So if it is eventually enacted, then it might not affect shops in food deserts where they're less likely to have larger stores, and the populations in those areas may not benefit from the policy. So any policy introduced will have to be reviewed and evaluated to determine whether there's been any kind of perverse impact through widening inequalities. And finally, our findings show that certain socioeconomic and demographic status puts some children at more risk. So there's a big question about how do organisations involved in supporting children to maintain a healthy weight mitigate against these risks when the root cause is actually out of their control. So the future, my final thoughts is the future is uncertain. We've had the pandemic followed by the cost of living crisis and other economic issues, and coupled this with the uncertainty of the future of the obesity strategy, we just don't know where we're going to go. But actually, recent projections that nearly 4 in 10 UK adults will be obese and 7 in 10 will be overweight or obese by 2040, tackling obesity at an early stage needs to be given greater urgency. Thank you. I will stop sharing now.
Thank you very much, Liz. Lots to take on board. All right, we're gonna hear from Isabel Rice from Sustain. Isabel is a registered dietitian working in food poverty and sustainability. She's passionate about good food for all. She's a committee member of the Public Health Specialist Group for the British Dietetic Association, and is here to talk to us about Sustain's work and the importance of developing sustainable food provision for children across London. And I'm going to share her slides, but I'll pass it over to you, Isabel, while I set up.
Thank you so much, Emily, and thanks, Liz, for that really fascinating talk. And thanks for inviting me to speak today on this really important topic, which unfortunately remains a huge issue in the UK. So my name's Isabel Rice. My background is that I'm a registered dietitian and I have a master's degree in global health nutrition and a background of work in research, clinical and public health nutrition, which is primarily focused on UK food insecurity. And at Sustain, I run the food poverty campaign, which I'll go into more detail about as we go. Could share the next slide, please. Brilliant. So to give a brief overview today, I will give a little bit of context to child poverty and food insecurity in the UK and talk about how food access impacts health. I won't go into that too much because Liz has just done a fantastic job. And then I'll focus on Sustain's annual Good Food for All Londoners report, which tracks and benchmarks council action across London on all areas of food work in London. And then I'll go through our main areas of work where we're campaigning for policy change to try and tackle root causes of food poverty in the UK, and specifically how this relates to child poverty and issues with children's health. Next slide, please, Emily. Brilliant. So we know that where children live affects what they eat and their health overall, as Liz has just described. And Emily mentioned earlier the social determinants of health, which Michael Marmot describes as the conditions in which people are born, grow, live, work and age, which can lead to health inequalities. So in London at the moment, from the most recent Trust for London poverty statistics, we know that in 28 out of 33 of the London boroughs, more than a quarter of children are currently living in poverty. And actually in some boroughs like Tower Hamlets and Newham, it's approaching half of the children living in those boroughs. And as Emily mentioned earlier, for the families on the lowest income, they would have to be spending at least 50% of their disposable income to actually meet the dietary requirements of their families, which is clearly not realistic or achievable, particularly when the cost of living is so high and there's so many other demands on household stretch budgets. Next slide, please. So just to give some context to the severity of the current situation, from the most recent food insecurity statistics that we have from the Food Foundation, we know that 17%, so about 9 million adults and about a quarter of households with children experienced food insecurity last month in June 2023. So really, really significant percentage. And 3 million adults reported going a whole day without eating anything at all because they didn't have enough money for food. And we know that many parents will prioritise feeding their children over themselves. However, 21% of households reported that their children were also directly experiencing food insecurity. So having to eat less food, having to eat poorer quality food, skipping meals, these kind of things. So we know that also certain minoritized groups are disproportionately affected by food insecurity in the UK, including disabled people, those with chronic health conditions, minority ethnic groups, members of the LGBTQ+ community, and people in receipt of universal credit and other benefits. And the Child Poverty Action Group have recently reported there's nearly 1 million children currently living in poverty in the UK that are not eligible to receive a free school meal. So that means many of them are missing out on vital nutrition that they could be receiving at school. So we know from charities, food aid providers, that many of them are struggling to meet this really high demand for emergency food aid, which is currently growing, but actually food banks and emergency food aid is just the tip of the iceberg. Only about 7% of the population used a food bank in the last year, but we know that actually about 17% of the population was really struggling. And while food aid providers work tirelessly to support people and pick up the pieces, they're not actually addressing the root causes of food poverty, which is what we try to look at with our work at Sustain. So we focus more on joint up strategic work to try and actually reduce poverty overall and improve food access, which does require efforts both at the national and local level. So next slide, please, Emily. So this diagram looks a little bit all over the place, but I'll talk it through briefly, and hopefully this demonstrates how nutrition through childhood has lasting effects and why this is so important. So if you can look at where it says child stunted, so if you're not familiar with the term stunted or stunting, this is actually a term that's generally used in global health and something that tends to be monitored in lower middle income countries. Ultimately, it means that children are shorter for their age than we would expect. So they're not growing as tall as we would expect. In the UK, we don't typically really talk about stunting because it's such a wealthy country. It hasn't really been an area of health that we've monitored and reported on, but actually pretty shockingly, we're seeing a decline in height in children in this country now. So the average child height at age 5 in the UK, when we compare to all the other countries in the world, our kind of ranking position has actually slipped down 30 places compared to where we were in the 1980s. So children are getting shorter, which is a key indication of poor diet and funding cuts to the NHS. So the most deprived groups of the population are actually shorter than the least deprived. So again, this highlights how poverty and inequality is a key issue here. So you might be thinking, why are we so fixated on height? Does it really matter if you're shorter? Well, actually, height is a really key indicator of health, inequality, and poverty. It's influenced by your diet, it's influenced by the environment around you, exposure to disease, unsafe or unsanitary environments, and the care that's received. So it's also actually an indicator of overall development. If you're not growing tall, then there's probably also other consequences in terms of your health. So for example, cognitive development or brain development, which is so key in childhood, but generally we see where people are not growing as tall as we might expect, there's also issues around cognitive development. And if a child is not reaching their full potential of brain development, then this is something that also will impact them for the rest of their life. So there can be some catch up in terms of growth of height and development as well in adolescence if things improve, but it's not going to be fully recovered. So this is something that would impact a child for the rest of their life, as this this diagram kind of demonstrates that actually if poor nutrition continues in adolescence, there would be impact to education, ability to learn, work, develop, and overall life chances of that person. And if they go on to then become parents, if they're not well nourished, if they haven't been well nourished through their life and are not well nourished during pregnancy, this can also impact on actually the health of the fetus and the child as it's growing. They might not be able to get all the nutrients they need. And also the parent might be more likely to have problems during pregnancy, actually higher maternal mortality as well. And then the child could be born kind of smaller than it should, or with other deficiencies, which then make them at higher risk of health issues throughout the rest of their life. So you can see this cycle just continues and actually passes on to next generation. So something that pops up throughout that diagram are the words inadequate food, health, and care. So in a country as wealthy as the UK, we shouldn't really expect to have issues with any of those, certainly not on a wide scale, because we have the money, we have the infrastructure to all children to actually access a healthy diet and a decent home and health and social care. But this isn't the reality that we're seeing at the moment, unfortunately. Next slide, please. So just very briefly about Sustain, if you're not familiar with us, we're the UK Alliance for Better Food and Farming. So we are a network of more than 100 members spanning various areas that relate to food in the UK, which includes children's food, poverty, food aid, public health, etc. And we believe that everyone should have access to healthy, sustainably produced food that protects people, animals, and the planet. So this is what we mean when we talk about good food. We work across 7 key themes, and good food for all, the one at the top, is the key area that I focus on. Next slide, please. So we also, to try and address these, we work both at the national and the local level. So we do lobby the government for change, but we recognise it's also possible to have a huge impact by working at the local level. And we see this coming to life through our work through councils, food partnerships, the Sustainable Food Places Network, some of our campaigns that you might be familiar with, one of which the Children's Food Campaign being particularly relevant here, which are currently having a big focus on campaigning for universal free school meals, which I'll talk a little bit more about as we go. Next slide, please. So a key area of my work is putting together the Good Food for All Londoners report. This is an annual audit survey that we do with all the councils in London, and we track the action that councils are taking on food. So if you're interested, I'll share the link in the chat after. I'd recommend having a read. You can see the league tables to see how different councils are performing, which councils are leading on different areas, and case studies of good work as well. And this looks at work across the whole food system, but half of the report focuses on work to try and tackle the root causes of food poverty. So this is what we refer to as the beyond the food bank approach. So looking beyond providing emergency food provision, what work are councils doing to try and actually tackle the root causes of poverty. So these are some of the areas that we look at. And we also strongly encourage engaging experts by experience in policy design and exploring alternative models to food aid that move beyond the food bank. Okay, next slide, please. Just to start by saying that we really support cash first approaches, but as a food organisation, we tend to focus our work more on the food dimension of poverty. So we don't work on this directly, but we do support it. And what we mean by this is the idea that people need enough money, whether through incomes, benefits, to actually match the cost of living so they can access the food they need in a dignified manner. So at a national level, we recognise this requires systemic change, policy changes so that we would see that social security payments and wages actually match inflation and match the cost of living, and some of the root causes of food insecurity would actually be addressed this way. But at the local level, there's also a lot that councils can do around providing adequate, well-promoted cash and timely cash payments to people that need it, as well as having really good support systems in areas such as financial advice, wellbeing support, employment support. So these should be addressed in tandem at a national and local level. Next slide, please. Also, to really highlight as well that food insecurity isn't the only issue that we have in our food system. It's an absolutely major one, but we ideally need to consider the different issues in the food system together in a strategic manner and taking a joint up approach. So across departments in the council, across various different stakeholders, to actually try and tackle all of these different issues. So not just food insecurity, that is a key issue, but also things like climate and healthier food environments as well. So as part of our approach to this, we support with running a network along with other organisations called the Sustainable Food Places Network, which really champions this approach. There are currently 93 food partnerships across the UK that are taking this kind of whole systems joined up approach. So this is an overarching recommendation of area of work for us at Sustain. And if you take the next slide, please, I'll go into a bit more detail about some more focused areas within the food poverty campaign that we are recommending. So within that food partnership, a key issue is food insecurity, and there needs to be a focus on this, whether via a food poverty alliance, which would be a group of organisations that are working on food poverty within a particular area. And we really recommend producing a strategic action plan. So this would be based on a needs assessment of the local area. So what is relevant and what are the key issues in a local area that are needed to tackle food poverty. So this can also be part of a wider food strategy. And this should take into account local projects that go beyond the food bank as well. So not just focusing on food banks ideally. Next slide, please. So our work around children's food, we mainly focus on areas like school food. So this includes the Say Yes campaign that I mentioned earlier, which is around universal free school meals, and also thinking about good food. So not just any food, but what food ideally do you want our children to be able to access. Also holiday activities and food, so that food support not just stopping during the school holidays. Healthy Start or Best Start in Scotland, and we also look at the UNICEF UK Baby Friendly Initiative, which is around breastfeeding, as well as other work to promote and support breastfeeding, which, as Liz mentioned, is really important. Next slide, please. So this is just a bit more information on our current Say Yes campaign. So our overall aim is for universal free school meals for all. So that's not just primary school, but nursery up until sixth form. So we know this is really key, and there's really robust evidence that this helps to kind of even out the playing field, and is really important in terms of tackling food poverty. But wider than this, it has impacts on educational attainment, economic outcomes. So it has broader benefits just than this. Within this, we're also aiming, so obviously that's a big overall aim. We're also looking at trying to ensure eligible children actually take up the meals, and using existing funds that's allocated from the government to support that holiday food and support, but also encouraging the government to expand eligibility to those in poverty. As I mentioned earlier, there's about 1 million children in this country who are living in poverty but don't have access to a free school meal at the moment. Also thinking about those meals being healthy and sustainable, so that really good nutritious food is getting to the children. If you want to get involved, you can go and have a look at the website. There's different actions people can take. You can join the map and show your support for this if you agree that we should have universal free school meals. Next slide, please. Another key area that we look at is Healthy Start. If you're not familiar with this, this is payment that's made to households, either where someone is pregnant or they have young children under 4 for families that are low income, or if the person that's pregnant is under 18. So these covers, this can be used to pay for milk, infant formula, fruit, vegetables, and pulses. So this can be a real help for families. But currently the national uptake is at about 65%. So we know there's about 1/3 of people eligible for this support that aren't actually taking it up, which equates to about £53 million that should be spent on this, that is not currently being spent by the government. So at a national level, what we are campaigning around is increasing, firstly, the value of the voucher, which hasn't really increased in line with inflation. So actually, you might have seen some things about this in the news at the moment, but the current cost of Healthy Start doesn't actually, the weekly amount that you get doesn't actually even pay for 1 packet of infant formula. So if you're feeding a child who's dependent on formula, this won't even cover 1. So we're seeing really heartbreaking results of people not being able to access enough formula for their children. We're also calling to expand eligibility. For example, people who have no recourse to public fund status, so this would include asylum seekers, don't have access to this, which would be a real help for them in terms of getting access to healthier food. And the other areas are auto-enrollment. So at the moment, you have to actually sign up to receive this, which is one of the major barriers and probably reasons that there is this shortfall in sign up, whereas people could be auto-enrolled, so they'd automatically be receiving this. Also, we work a lot at a local level, particularly with councils and food partnerships. So looking at things like having a dedicated council officer who works on this, and having a councillor who promotes this within the local council, so that there can be better promotion, and that can help to increase uptake, as well as training for relevant staff across the local area. These are all things that can be done, and we know that this helps to increase uptake. Next slide, please. So here are a few examples that we found during our Good Food for All Londoners report, so on particularly good work that can be done in this area. So Waltham Forest, they actually host every year a Black Breastfeeding Week, which is an annual celebration. They provide advice and support, and this is helping to improve rates of breastfeeding among Black and Asian households in the borough. And they also fund a role that works exclusively on the Healthy Start scheme. And this has meant that they've been able to put a lot of focus on this area and help promote uptake. Also, there's brilliant work going on in Kingston, which is they have their own dedicated infant feeding partnership, which involves representatives across health, but also importantly involves volunteer mothers. And this helps inform all of the work they're doing across breastfeeding and infant feeding in the borough. And we see that actually they have some of the highest rates of breastfeeding at 6 to 8 weeks in the whole of London. Next slide, please. Another really important area that was touched on by both Emily and Liz is around healthy food environment. So the environment we live in really affects our health and what we eat and what we're able to eat and what we're able to access. So some of the work we do around this is promoting local healthier food advertising policies. So you might be aware that in 2019, the Mayor of London brought this in on Transport for London. So I don't know if something that you've noticed when traveling around London, getting on the tube or the buses, you won't see any adverts for unhealthy foods anymore. And there's, I think, about 5 or 6 boroughs now that have brought this in. So there's really good evidence from across these in terms of how much difference this makes, particularly to what children are eating and health outcomes. We've also worked on the soft drinks industry levy, which was the sugar tax on drinks. And this has seen a reduction in sugar in soft drinks by 44% since that came in. So we work on areas around kind of encouraging tax and reformulation and things like that. Also on schemes that support children, particularly to eat more fruit and veg. So as well as Healthy Start, there's a campaign called Veg Cities that works with areas to increase the amount of fruit and veg that's available to children, and also the school fruit and vegetable scheme, which provides these as extra snacks for children. There's also great work going on around convenience stores in London to increase the healthy food availability at affordable prices, because often there's very limited fresh food and very limited healthy food offers in these stores, but there's been some great work to show that this can be increased, and when it's increased, people are actually accessing it and buying it. Next slide, please. So other key areas that we work with and that we promote work on with councils and food partnerships. We know that some groups have additional barriers to access and are at higher risk of food insecurity, so particularly older and disabled people, minority ethnic groups, people with no recourse to public fund status, and which includes refugees and migrants and asylum seekers in many cases. These groups face additional barriers, and this particularly, of course, affects children within a household. Next slide, please. So finally, just to touch on a new area of work that we're looking at, which is exploring alternative models to food aid. So here I'm talking about things like food co-ops, pantries, social supermarkets, community cafes, meal services, and other kind of local buying groups. So these are kind of moving away from food aid towards trading models. So essentially there's some cost involved, but they do seek to provide lower cost, more affordable food. Often this is kind of response to a need in the community where people might be struggling with food insecurity. And we're, in a lot of cases, these are attracting social investment to develop from organisations like councils and housing associations who are seeking to support residents. But what we see is these are really community-based, community-rooted, so they're buying for the community, and ideally places people want to be, food spaces that are welcoming and interesting, so people are there because they want to be, not just because they have to be because of lack of access to food. So we are currently working on a new project which is exploring good practice in this area, trying to work out some solutions to issues such as food supply and financial sustainability, and looking at how this area can progress. Now, we're not saying this is going to solve the problem of food insecurity. Obviously, there needs to be, hopefully my talk demonstrated, there needs to be lots of different actions across lots of different areas of policy, and there really does need to be national change and improvement to this policy. But we do see this as an area where there's huge proliferation in response to need, and also an area of opportunity in terms of supporting communities, getting the help that's needed, accessing better food. So this is another area that we're looking at. And I think last slide, please. It's just a say thanks so much again for inviting me. Thank you for listening, and very happy to take any questions.
Amazing. Thank you so much, Isabel. So we're nearing 4, but both speakers have kindly said that they can stick around for a few extra minutes. So we're going to go to 10 past before we end today's event. But if I haven't seen any questions pop up in the chat, but if you do have a question, feel free to raise your hand, and I'm keeping an eye on the group. Or if you'd like to type out a question in the chat, then I can read it out on your behalf. I'll give you just a couple of minutes. Yes, I see a raised hand with Honey. Go ahead.
Hello, lots of really interesting things. I was just wondering, you mentioned working with convenience stores to increase healthy food available at affordable prices, and where and how do you do that? What's that look like?
So this is linked. I don't know if you'd want to add anything to this, Liz. You mentioned convenience stores. This is a project that's linked with the Greater London Authority, Mayor of London, and Impact on Urban Health, who have been funding some quite interesting and innovative work with convenience stores in particular boroughs of London. So this is including Lambeth, Southwark, Newham, and I think Greenwich. So what they're doing is actually working with store owners, and the council, the project, is initially funding the cost of introducing new streams of healthier products into a store that a shop owner would probably not introduce themselves because of fear of risk of people not buying it and losing money. So that initial cost is footed by the council, and they're supported to introduce that. But what they've seen over the initial stages is that those products are actually then selling really well. And they can also link in, for example, to that Healthy Start scheme. So people can actually use their Healthy Start vouchers to buy some of those healthier products, which has been really helpful because people might actually feel more comfortable using their Healthy Start vouchers in their local shop. They might struggle to get to a bigger supermarket where they could spend it as well, but also it means that the money from the Healthy Start voucher is actually going to the local economy rather than going to a supermarket. So this is quite a early stage. There's been a few sort of pilot projects, but this is something that's continuing. So if you have a look on the GLA website, you might be able to find out a bit more about this. But this is also, if you look in the Good Food for Londoners report, which I shared in the chat there's a whole double-page spread about this convenience store work if you'd like to read and find out a bit more about it.
Right, thank you. We've had another question to Isabel. Can I ask where the pilot or existing spots for the food co-op alternatives to food banks are?
Oh, yes, you can. So our initial kind of investigation research work is partnered with 4 areas in England. So we're working with Waltham Forest in London, Liverpool, Brighton and Hove, and Bury, which is in Greater Manchester. So these are the initial areas that we're looking at, but these kind of projects are existing all over the country, and more coming all the time. There's lots of them in London, and Sustain does actually have a food co-ops webpage, which I can share a link in the chat, which has got lots of information about food co-ops and community food enterprises. It's about to be refreshed, but there is, so it will be more updated in a few weeks, but there is lots of information about there if you want to find out more about that.
Right, thank you. I don't see any more raised hands at the moment, but I did want to ask Liz, because of the new kind of, not new, but newer integrated health community initiatives and the integrated systems, you talked about the complexity of the links between child poverty and child obesity. and the different possible factors to consider. How might local groups, local health professionals kind of take that on board in a place-based context, or what factors, what kind of first steps might they use with your research?
Well, it'll all be very dependent on the integrated care system involved. I mean, some of our research just generally about the integrated care systems and how they're working is very much kind of, it's not about the structures themselves, it's about the working relationships between the different organizations, and building that kind of culture and that collaboration is hugely important. So that would be the first sort of step, just more broadly about how effective integrated care systems work. I think it's recognizing that no one organization holds the kind of, holds this as their kind of task. It's going to have to take, that collaborative working together. There's no silver bullet to childhood obesity. And it's thinking about a whole range of different things. It's not, as I said, about the individual behaviours. It's like what Isabel was saying there about incentivising, changes to the local environment to make it, a better environment for children to grow up in, and help tackle problems with obesity and overweight.
Yeah, it's very well said. All right. Any final questions? I know a few people have asked about the slides. Yes, we'll be sharing the slides. I'll be sending you a follow-up email later today or first thing tomorrow. If there's no other questions, I just want to take this opportunity again to thank both of our speakers. Thank you very much for the work that you do, as well as the time it takes to prepare a presentation like this, and then also to share it with quite a varied audience. So thank you very much. I've learned a lot and will be taking it on board in my own work, and I'm sure I'm not alone in that. So well done. It was a pleasure to have you both, and we'll be in touch soon. And I wish all of you a very good afternoon, and I'll see you at another 4 in 10 event soon.
Thanks for having us.
Yeah, thank you so much, Emily, for organising everything.
You're very welcome.
Thank
Bye,
you.
all.
Sorry, can I come in? Thank you, Emily. It's been very interesting to hear different speakers and get an insight. And thank you. I really found it useful, and some of the stuff you shared, particularly around the COVID and the impact of COVID and obesity and all the rest of it. And I think, and your poverty and all the rest of it, I think it's really important to know these things. So thank you so much.
Yeah,
and I shall see you. It's Hamidia, so thank you so much. Take care.
thank you. Same to you. Thank you, Hamid.
Take care. Bye-bye. Bye-bye.
Bye.
Bye.